Tiba-tiba Lopa menyuruh ajudannya untuk menghentikan mobil, kemudian bertanya. Lopa terkenal sebagai sosok yang cermat dan berhati-hati.
Selamat pagi, Bu Direktur.
Iya,
Ya, mohon izin untuk memulai acara, Ibu.
apa judulnya itu? Mana ya? HIV infection and cancer risk. HIV, infeksi HIV dan risiko kanker. Kayak kuliah umum, kayak ilmu tambahan gitu.
Jurusan Teknologi Laboratorium Medis, Politeknik Kesehatan Denpasar, hadir dan berkembang dalam dunia kesehatan di Indonesia. Hal ini menjadi tantangan tersendiri bagi jurusan kami untuk menghasilkan tenaga kesehatan khususnya ahli teknologi laboratorium medis yang bermutu, terampil, profesional dan tanggap terhadap ilmu kesehatan, serta mampu memberikan pelayanan kesehatan dan pengabdian kepada masyarakat.
Attention to all guest lecture series 5 participants. We invite you to fill in the registration link first. The registration link can be accessed by via scan barcode or by room chat room. Thank you. Before the event starts, we inform all participants to activate the camera and deactivate the microphone first. And we remind all participants to rename their study program _semester _last 3 digit of student ID _name. Thank you.
Oh, bagus.
Please pay attention. The event will begin soon. Welcome to all of you. Om Swastiastu. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, Salam Kebajikan. Greetings to all of us. It is an honor for me, Angeline, as the Master of Ceremony, to be able to guide the event today. Good morning and welcome to the Honorable Director of Poltekkes Kemenkes Denpasar, who we respect, our guest lecturer, Om Nia Reda, MD, PhD, and the Honorable Vice Director, First, Second, and Third of Poltekkes Kemenkes Denpasar, the Honorable Head of the Internal Inspection Unit, Poltekkes Kemenkes Denpasar, the Honorable Head of Department of Medical Laboratory Technology, and all the Head of Department of the Poltekkes Kemenkes Denpasar, the Honorable Secretary of the Department of Medical Laboratory Technology of the Denpasar Ministry of Poltekkes Kemenkes, the Honorable Secretary of the Department of Medical Laboratory Technology of the Denpasar Ministry of Poltekkes Kemenkes Denpasar, the Honorable Head of the Study Programs of the Denpasar Polytechnic of T lectures and staff of the Medical Laboratory Technology Department of Poltekkes Kemenkes Denpasar, and the entire academic community of Poltekkes Kemenkes Denpasar, which we are proud of. Praise to God Almighty, because it is thanks to His grace that we all can meet online in the guest lecture series 4 event organized by the Department of Medical Laboratory Technology of the Denpasar Health Department of Medical Laboratory, with the topic HIV infection and cancer risk, on this day, Friday, June 21st, 2024. The Honorable Ladies and Gentlemen, the order of today's program is, our first agenda is opening. The next agenda is singing the national anthem, hymn and march of Poltekkes Kemenkes Denpasar. The next agenda is prayer. The next agenda is remarks by the Director of the Poltekkes Kemenkes Denpasar or representative. The next agenda is CV reading and moderator introduction. The next agenda is introduction of speaker. The next agenda is presentation and discussion session. The next agenda is certificate presentation ceremony to moderator and speaker. And the last agenda is submission of final attendance and closing. Ladies and gentlemen, to begin our program today, let's sing the national anthem, hymn and march of the Department of Denpasar Poltekkes Kemenkes. To the committee in charge, please start.
bukti dan tulus pengabdianku bagi nusa dan bangsa, mewujudkan seluruh masyarakat senyum, sehat, dan bahagia. Dirgahayulah alma materku, Politeknik Kesehatan Denpasar. Majulah terus, amalkan tugasmu, laksanakan tridharma perguruan tinggi, asas Pancasila, dasar dalam berkarya. Harumkan alma mater tercinta, Politeknik Kesehatan Denpasar. Marilah profesional kesehatan, bulatkan tekad dan semangatmu, mengabdi pada bangsa Indonesia, berbakti pada Tuhan. Kesehatan bersatu padu dalam berkarya, sumbangkan ilmu dalam pengabdian demi terwujudnya masyarakat sehat. Kibarkanlah panji kesehatan ke seluruh pelosok negeri, junjung tinggi rasa kemanusiaan, kesehatan pasti tetap jaya. Bulatkan tekad dan semangatmu, mengabdi pada bangsa Indonesia, berbakti pada Tuhan Yang Esa. Marilah profesional kesehatan, bersatu padu dalam berkarya, sumbangkan ilmu dalam pengabdian demi terwujudnya masyarakat sehat. Kibarkanlah panji kesehatan ke seluruh pelosok negeri, junjung tinggi rasa kemanusiaan, Politeknik Kesehatan pasti tetap jaya.
Ladies and gentlemen, the next program is prayer. I will lead the prayer. Let's pray according to each religion and belief. Pray begins. Prayer can be ended. The next event is remarks from the director of the Poltekkes Kemenkes Denpasar, as well as officially opening the 5th day guest lecture series. Time and place, we present Dr. Sri Rahayu.
Okay, thank you, Master of Ceremony. My voice is clear? Hello?
Yes, it's clear.
Okay.
Sri Rahayu.
Oke, baik. Good morning, ladies and gentlemen.
Good morning, Dr. Sri Rahayu.
Ya, Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Salam, Namo Buddhaya, salam kebajikan untuk kita semua. The honorable speakers, Ibu Omnia Reda, PhD from Medical Microbiology, Alexandria University. Manager at Health Polytechnic of Denpasar, include Head of Internal Supervisory Unit and Secretary, Head of Academic and General Administration Division, Head of Department Center Special, Head of Department Medical of Laboratory Technology, Head of Study Program and Secretary, Special Moderator, Ibu Wilan. Thank you, Ibu Wilan, to support this agenda.
You're welcome, Ma'am.
Lecturer and staff Medical of Laboratory Technology, and we would like to extend our heartfelt appreciation to all the participants. Further, our gratitude to both the invitees and attendees who have brought immense joy and pride to our event. First of all, let us offer praise and
I'm sorry, Mom, it's mute.
I'm sorry. Okay. Hello?
Yes, it's already on.
Okay, yes. Okay, I repeat. First of all, let us offer praise and gratitude to the presence of God Almighty, who always gives His mercy and grace to all of us, so that on this occasion we can hold guest lecture series 5 with the theme HIV infection and cancer risk. We would like to thank the invited guests who have agreed to attend, as well as the committee who have prepared this morning activities so that this agenda today may run smoothly. We really appreciate the activities carried out by the Medical of Laboratory Technology Department. Thank you, Bu Diana and team, that organized this agenda. Ladies and gentlemen, we know the HIV problem is a big problem that threatens many countries in the world, including in Indonesia. Data on HIV cases in Indonesia continues to increase from year to year. HIV damages the human immune system, causing people infected to HIV to lose the immune system, so they are easily infected and die from various infection disease, cancer, and the other. This topic is so very interesting and also in line with the Poltekkes Kemenkes Denpasar, especially subspecialistic related to cancer. Therefore, by raising the theme HIV infection and cancer risk, it is hoped that students can use this opportunity to understand more about HIV and cancer risk, which is currently phenomenon in society. Finally, on behalf of Poltekkes Kemenkes Denpasar, I would like to thank all participants. May God Almighty always keep His grace to all of us. We close with Assalamualaikum warahmatullahi wabarakatuh. Om Santi 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 Om. Thank you.
Thank you, Dr. Sri Rahayu, for the amazing opening of today's 5th day guest lecture series. For invited guests, if there are activities that cannot be left, they are allowed to leave the Zoom room. The next is introduction of the moderator. Our moderator today is Miss Lu Ade Wilan Krishna. Was born on January 19, 1983. Her affiliation is Lecturer of Medical Laboratory Technology Poltekkes Kemenkes Denpasar. Employment History Lecturer, Polytechnic Kesehatan Kemenkes Denpasar. in the year 2012 until present. Researcher in Biomedical Science, Institute of Tropical Disease, Airlangga University, Surabaya, from year 2010 until 2012. Assistant of Pathologist, Laboratory of Pathology, Surabaya Oncology Hospital, Surabaya, from year 2005 until 2010. Education, Bachelor of Science, 10 November, Institute of Technology, Surabaya, Indonesia, from year 2000 until 2005. Master of Basic Medical Science, Airlangga University, Surabaya, Indonesia, from year 2008 until 2010. Certificate of Higher Education in Virology, Kobe University, Kobe, Japan, from year 2010 until 2011. Doctor of Philosophy, Kumamoto University, Kumamoto, Japan, from year 2017 until 2021. Without any further delay, let's welcome our moderator today. Good morning, Miss Wilan. How are you doing in this sunny day?
Good morning, MC. Angel, thank you.
Okay, Miss Wilan, are you ready to guide the guest lecture series 5 today?
Yes, sure. Let's start.
Well then, we welcome your time and network.
Thank you. Okay, thank you to the MC for the time that's given to me and the introduction. First of all, let me greet all of you. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Salam, Namo Buddhaya. Sabahul Khair for Dr. Omnia, and then Ohayo gozaimasu. Dr. Omnia.
Ohayo gozaimasu. Thank you.
Oh, genki.
Thank you. Genki desu.
Genki desu. Hai. Oh, hisashiburi. So, Dr.
Hisashiburi
Omnia.
desu.
Hisashiburi desu. Hai. Let me greet another guest first. The respectable Director of Politeknik Kesehatan Kemenkes Denpasar, the honorable speaker for today, Dr. Omnia, the distinguished guests, and all the participants of the event. Ladies and gentlemen, good morning, everyone. Welcome to the 5th series of guest lecture brought to you by Department of Medical Laboratory Technology. Before we start the session, I have, let me introduce myself first. My name is Luhadi Wilan Krishna. So, Dr. Omnia is my colleague in PhD program. And yeah, I will be your moderator for today. Before we begin, I have a few notes to share to you as the participant. So this session will be recorded. And then the presenter, Dr. Omnia, you have about 45 minutes to present. And then another 15 minutes for discussion. And if you have any question for the presenter, please raise your virtual hands and turn on your microphone. When I call on your name, so please deliver your question to the Dr. Omnia. Or you can write your question in the chat box in this meeting room. This event is broadcasted live on YouTube, and also it will be available after the live session through HMJ TLM YouTube page. Okay, so that's all the notes that I need to mention before. And then first and the foremost, I'd like to thank the organizing committee for arranging this event and giving me the chance to be a moderator for this event. Thank you very much. It's been an honor to me. And also to all participants that here, I have 287 participants this morning. Thank you so much for taking time out of the day so you can attend this guest lecture series. We are pleased to inform you that among us here, we have a fellow researcher and also a lecturer of Medical Microbiology Faculty, Alexandria University, Egypt. Please welcome Dr. Omnia Reda, MD, PhD. Good morning, Dr. Omnia. So, ohayo gozaimasu again.
Good morning, Dr. Whelan.
Yes, we have a different time between Bali and Japan. So, Japan is 1 hour ahead of Bali.
So you are too early now. At my
Uh,
time is 10:20 now.
Yes, that's right. Yeah, Dr. Omnia is one of the fellow researcher and also a lecturer. I will read her curriculum vitae first. She is received her bachelor degree in medical and medicine and surgery, and then the master degree in public health, both taken at Alexandria University in Egypt. And then she took her doctoral program in medical science at Kumamoto University, Japan, major in HIV, infectious disease. So her PhD project, which is I just read just now, it's a very amazing project, Dr. Omnia. It's about HIV Toki system to visualize a proviral expression dynamic. For today's event, Dr. Omnia will talk about HIV infection in general, and then how the infection can lead to the cancer risk. So without any further ado, please join me in welcoming Dr. Omnia Reda. The virtual floor is yours, Doctor. Please.
Should I start from now?
Yes.
Okay.
Please.
So good morning, everyone. It's my great pleasure to be invited for the guest lecture series today. And yeah, I find it like my honor to join an event in Indonesia for my first time. I would like to thank the director of Medical Laboratory Technology, Paul Tekes, the head of the department, and the moderator of today's event, Dr. Whelan, my friend and colleague during my PhD studies in Japan, Kumamoto. I would like to extend my thanks to all the organizers and moderators of today's event, and for all who have taken their time to attend the lecture today. I hope you find the content beneficial, and as Dr. Whelan mentioned, at the end, please feel free to ask as many questions as you want. So my voice is clear. I just want to check first.
It's clear, Doctor.
Clear?
It's very
Okay.
clear.
Right.
Yes.
Thank you. So today's topic is about HIV and the risk of cancer. So I prefer to give first go for HIV overview for everyone to know information about HIV. Then at the end of the lecture, we will go through the malignancies and some mechanisms of induction of malignancies by HIV. So for the first part of the presentation, we will go through HIV overview, prevalence, causes, stages, and symptoms, genomic structure, diagnosis, and prevention. So, just a second. HIV is the causative agent of AIDS, which is acquired immunodeficiency syndrome, as introduced by the director today. She mentioned that it's a disease which affects and damage the immune system. So HIV is a virus which attacks the immune system, and if left untreated, it will progress to this AIDS, like the complete full-blown picture of HIV infection. So AIDS is the acquired immune deficiency syndrome, which describe a potentially life-threatening infection and illness due to severe damage of the immune system by HIV. So let's check the prevalence of HIV. So these are the numbers that we can record about HIV prevalence in 2022. So in total, people living with HIV are around 39 million people, and people dying from HIV-related causes are around 630,000 people. This disease can affect children, and as we can see that in 2022, 1.5 million child was affected, and 84,000 of them died because of HIV-related disease. And if we look at the whole picture of HIV prevalence since the start of epidemic, which started around 1981, which started around 1981, we can see that the total number of infected people up to the moment are around 85.6 million, and the death from AIDS-related illnesses are around 40.4 million people. The good news is there are some medical treatment for HIV, which I will explain later in the slides. So there is a good ART access in different countries, which was recorded in 2022 to reach 29.8 million. So 29.8 million cases of HIV has reached the antiretroviral therapy easily, which is a good achievement so far. So what are the HIV causes? So the virus is spread and transmitted from person to person through certain body fluids, which are blood, semen, rectal fluids, vaginal fluids, and breast milk. HIV need a broken mucous membrane to be transmitted. So this broken mucous membrane could be in the mouth, penis, vagina, or rectum. Any kind of damaged tissue or some kind of cut wound, and of course the bloodstream by injection. So the modes of person-to-person transmission can include unprotected sex with an infected partner, sharing needles with infected persons, vertical transmission from the mother to the child, and of course infection from unscreened blood products. But the vertical transmission, luckily, is a less often method of spread. However, it happens. And the needle stick, like small needle stick or sharp object, also is luckily less often to transmit the disease. However, it is recorded to cause the infection of HIV, especially in healthcare workers. So HIV, just to be safe, is not spread by casual contact with those who are infected. It's not spread by mosquitoes and bats, which is a blessing. Also participating in sports, touching items, or eating food, sharing food with HIV-infected persons, all these are not modes of transmission of the virus. So from the previous slide, we can conclude that HIV risk factors are having unprotected anal or vaginal sex with infected persons, using drugs, sharing needles or syringes, of course, having a sexual partner who is HIV infected and is not receiving the medicines, and having additional sexually transmitted disease could be a risk factor to be infected by HIV. So in the next slide, I will show the stages and symptoms related to each stage of HIV. So in this couple of slides, we will focus on HIV if untreated. So how HIV infection would progress without treatment. So without treatment, HIV infection gradually destroys the immune system, as we have mentioned, and it eventually ends into AIDS. The main three stages of HIV infection are acute HIV infection, chronic HIV infection, which ends by AIDS. And in this figure, we can see the number of CD4 T cells, which are the primary target being destroyed by HIV infection, in proportion to HIV particles. So as we can get from this figure, that before HIV infection, the blood is clear of the virus, of course, and having a good CD4 cell count. In the stage of acute HIV infection, CD4 T cell count starts to decline with a very high. Everything is okay?
Yeah,
Okay.
it's good,
Okay.
Dr. Omnia.
Okay. So in case of acute stage of HIV infection, the CD4 T cell count decreases, while the virus particles are very prevalent in the blood of the infected patient. And then during the chronic HIV infection, the virus particle and replication reach some steady stage while still affecting and decreasing the number of CD4 T cells until we reach the last and most severe stage where the virus particles are very, very, very prevalent in the blood of the infected patient, while the CD4 count is almost nothing. And here is the stage of encountering various co-infections or malignancies in HIV-infected patients. So to have a clear explanation for these stages, again, we can look at this figure to recap on the previous slide. Acute HIV infection stage develops within 2 to 4 weeks after infection, and the infected person only presents some flu-like symptoms like fever, headache, and rash, non-specific symptoms. HIV virus particles multiplies rapidly and spread through the body. And of course, HIV attacks and destroys its main target, which is the CD4 T lymphocytes. The patient at this moment has a very high viral load, and the risk of transmission, of course, is very high. During the chronic HIV infection stage, which we call the asymptomatic HIV or clinical latency, because at this stage, the infected person rarely present any kind of symptoms, almost no specific symptoms, no symptoms. And then the HIV multiply at a slower rate. And this is a kind of, HIV policy to keep itself alive and attacking the immune system in a very quiet way, because being so prevalent inside the blood will help the immune system to eradicate the virus. So the virus needs to keep some kind of quiescent infection and slow multiplication rate, and then it would attack the immune system more efficiently. And this stage can last up to 10 years in some patients. The final fulminant picture of HIV infection is AIDS. It's the final and most severe stage. Immune system is severely damaged. Like as we can see here, it's like almost no CD4 T cells. CD4 T cell count start to get less than 200 cells per millimeter cube, and this is the stage inviting opportunistic infections and infection-related cancers. HIV viral load and risk of transmission, of course, is very high. And if the patient is still untreated and no access for treatment at this stage, survival rate is sadly around 3 years. So before we go to the diagnosis of HIV, we need to have some hints. I wouldn't go into like deeply in the structure of HIV, but we need to know some highlights from the genomic structure of HIV. So HIV is a single-stranded virus of the Retroviridae family. And retroviruses meaning that those viruses that integrate into the host genome after infection. They have a special machinery to help them integrate into the host genome and, of course, hide from the immune system by this way. HIV is a spherical, as we can see, envelope virus. The virus particle diameter ranges from 20 to 120 nanometer in diameter. Each virion carries 2 copies of around 10,000, 10 kilobase of positive sense RNA. So as we can see, it's 2 copies of RNA. And if we zoomed in to look at the genomic structure of HIV, we can see that the LTR region is the viral promoter, meaning it's the region responsible for the transcription and translation of important structural and accessory proteins of HIV. The importance of these structural and accessory proteins is in the diagnosis for us, and also for, of course, for the research domain. But in terms for diagnosis, we can focus on the core structural protein, which is GAG or P24, very important in the detection in case of diagnosis. And for the HIV life cycle, it has a lot of regulatory proteins, TET and REV, which are transcribed from these regions, and some accessory proteins which help the virus entry and egress. For example, are the NEF protein, VPR, VPU, and VIF. So how HIV is diagnosed? So HIV testing in general includes two-step process. One of them is screening, which is just checking the antibodies to the HIV virus or the HIV antigen, or both of them. The second process is the follow-up test or the confirmatory test, which is performed in case the screening test is positive. So who should do or who should proceed for the screening or follow-up test of HIV? So the Center of Disease Control and Prevention, the CDC, recommend that every person, even the normal ones, aging from 13 to 64 years, should have screening test at least once in his or her lifetime. Of course, people with risky sexual behaviors should be tested on a regular basis to avoid infection of their sexual partners. Pregnant women should have a screening test to make sure that there is no chance of vertical transmission to their babies. And people who have been diagnosed with other diagnosed or treated with other sexually transmitted diseases, hepatitis, or tuberculosis should also have a screening test. So what are the actual assays used for HIV diagnosis? So first one is a rapid diagnostic test, RDTs. These tests are qualitative immunoassay tests that can give a very rapid result within 30 minutes, and they are capable of detecting HIV antibody or P24 antigen. And they can use the capillary blood just by a needle stick, something like that. They're very easy to do, and they are among the screening process of HIV. So the next step, if somebody is positive for this rapid diagnostic test, then we should proceed for nucleic acid testing, which can provide a quantitative information about the HIV infection. Because the nucleic acid testing is based on PCR reactions or nucleic acid sequence-based amplification to confirm the presence of HIV genetic material in the blood of the infected individual. And the sensitivity of this kind of tests is very high. So they have a typical limit of detection of 50 copies per mil, which is very low. So even at a rate of 50 copies per mil of virus genetic material, these tests can give a positive result. And the final and superior confirmatory test is the Western blotting or immunoblot. So the Western blot detects the antibodies that react to HIV protein. And in brief, if you are not familiar with the Western blot, that we take some kind of HIV lysate inside the cell, and then we run this lysate on a polyacrylamide gel to separate viral proteins according to their molecular weight. This test is, very specific, but the problem is it takes longer time in comparison to any other diagnostic test, but it's like the top confirmatory kind of assay in case of HIV diagnosis. So the results can, in case of infected patient, we can detect the HIV proteins by this kind of confirmatory test after 5 to 6 weeks following initial HIV infection. And I'm here showing an example of different HIV gene and product, like the gene and its protein product, and how they should be represented in the on the polyacrylamide gel in case the patient is actually infected by HIV. We can see the most famous one, the GAG precursor, P55, the core protein that I have just mentioned, P24. So they are, how to say, classified on the gel by their molecular weight, and they confirm the infection of HIV. So we also need to make how to say, keep a remark in our minds of the HIV diagnostic algorithm. So which test should we do first? So HIV 1 or 2 antigen and antibody immunoassay should be done first. This kind of rapid identification test. If the person is positive at this level, then we do some kind of differentiation between which HIV strain is infecting this patient. Is he positive for HIV 1 or 2, or both of them, or none of them, meaning that this rapid test has some kind of non-specificity. So that the positive band seen in this test was not, how to say, sensitive enough. So in that case, especially in the if the immunoassay is indeterminate, we proceed for detection by nucleic acid, as I have just mentioned. Nucleic acid will give the qualitative reply to us about the infection status of the patient. And moreover, we need to confirm by the Western blotting. And this graph, I'm happy to share this graph because it's very, very informative, linking which stage of HIV we can detect which kind of test from the previously mentioned ones. So on the level of HIV P20, first let's go for the HIV RNA, which is just the pure genetic material of HIV. We can detect the HIV RNA in blood starting from around 10 to 15 days post-infection during the acute HIV state. And this could be followed by presenting HIV P24 antigen, which can be detected around 20 days post-infection. And the last one to come, of course, is the HIV antibody that we can detect in 25 days after infection. And the importance of this graph that in the course of HIV, starting the treatment as early as possible can drastically change the fate of the disease and of the infected individual. So we need to know like the feasibility of our detection systems just to help the early application of antiretroviral drugs. But as we can see that during the first 10 days, it's almost impossible for the patient to be diagnosed by any of these tests. I also want to mention what happens after, like which kind of test we need to use after the patient is already diagnosed with HIV. So for people living with HIV, they should have first a regular check of their CD4 T cell count. This is very important because a normal CD4 count for a healthy subject should range from 500 to 1,500 cells per millimeter cube of blood. But people usually develop symptoms like after infection with HIV when their CD4 count drops below 350 cells per millimeter cube. And of course, more serious complications come if this number drops more and more until below 200 cells per millimeter cube, meaning that this infected individual already started his AIDS stage. And of course, side by side for the CD4 T cell count, we need to keep an eye on the HIV-1 proviral load or RNA level. And during the treatment, some patients develop some kind of resistance due to some genetic mutation in the virus structure. And for that, we need to make some resistance tests to make sure that they are still responsive for the treatment they are given, and the virus is not resistant to the regimen they are treated with. And finally, for this section, HIV overview section, let's look through HIV prevention. So how to protect ourselves from this disease. So we should reduce the risk by having safe sexual practices, using condoms or others. Ensure that the partner is HIV free by, as we said, at least screening once in life, especially for the married couples. And also some kind of drugs called pre-infection prophylaxis are some kind of drugs that help to abort the infection of HIV taken as early as possible if somebody is exposed to some kind of needle stick or any accidental blood transfusion, including HIV. And this PrEP is very helpful for healthcare workers that, for example, can encounter an incident that they may suspect their infection by HIV. So the PrEP regimen can help them to abort HIV infection. And of course, we should not share any kind of needles or sharp objects with each other, and getting tested regularly for sexually transmitted infection. So in brief, HIV screening at least once. And of course, nobody should use any kind of illegal drugs. No sharing of needles or syringes. Avoid contact with another person's blood or blood products. This is very important. And for healthcare workers, we should, of course, wear the protective clothing, mask, goggles, and everything that keep us protected from the blood product of any patient. And in case of a mother who is diagnosed for HIV, of course, she should stop breastfeeding to minimize the risk of transmitting HIV to her baby. Do you need a break, or should I continue?
Yes, please continue, Dr. Reda.
Okay. So for the next section, I will focus on HIV life cycle and treatment modalities in brief, but I want to share this very informative diagram that show two kinds of information. First one in blue are the stages of HIV infection, how the HIV life cycle starts and ends through infection cycle inside one cell. And the next piece of information is the treatment modalities that have been used for eradication of HIV in red. So let's first overview what are the steps of HIV life cycle. So HIV first, this is the HIV particle, and this is the cell to be infected. HIV first binds or attach to the cell surface. And this is facilitated by the CD4 receptor mainly. And as I mentioned, the CD4 T cells are the main targets of HIV. And this CD4 receptor is also helped by some co-receptors like CCR5 or CXCR4, if you want to keep the name. And this co-receptor action helps the attachment and binding of HIV virus particle. Next step is the fusion. So the HIV envelope and the CD4 cell membrane fuse together, allowing the genetic material of HIV to be passed inside the cell. And then, as we can see that HIV RNA is released inside the cell. And after this release, this HIV, as I said, HIV is a retroviruses, one of the retroviruses, meaning that HIV aim is to integrate inside the host cell DNA. And to obtain this shift between RNA and DNA, the RNA genetic material requires reverse transcription inside the cell. So HIV release and use a reverse transcription, which is an HIV enzyme, to convert its genetic material from RNA into DNA. And this conversion first will allow the HIV DNA to enter the nucleus of the cell, which is the main target of the HIV. And later, during step 4, which is integration, the HIV DNA genetic material will integrate inside the host cell by using the integrase enzyme, which is also transcribed by HIV. So after this step of integration, replication is very easy for HIV because it's already inside the host cell and can be transcribed along with the host cell DNA. So once integrated into the CD4 cell DNA, HIV begin to use the machinery of the cell itself and transcribe and translate its required proteins. And after the new RNA copy and HIV proteins are transcribed using the CD4 T cell machinery, the next step is the assembly, meaning that HIV will seek making a new virus particle. And this so HIV RNA and proteins move to the surface of the cell and assemble into immature, still non-infectious HIV. And then the final step is budding, meaning that the virus will be released from the surface of the cell and newly infectious particle will come out of the cell by also using part of the cell membrane as the envelope of the virus. And then using the protease enzyme, which will help the virus to be cut out from the cell surface, and then new virus particle is produced and the life cycle is repeated again. So this is for the life cycle main steps. What about the HIV curative strategies so far? So HIV curative strategies so far are some drugs that attack or try to attack some steps of HIV replication cycle. So we can see at the binding step that we have CCR5 antagonist and we have some post-attachment inhibitors. At the level of fusion, we have some fusion inhibitors, but the most famous and most usable drugs come at the stage of the reverse transcription. So they includes non-nucleoside reverse transcriptase inhibitors and nucleoside reverse transcriptase inhibitors. These are the famous regimens for treating HIV. Of course, research and a lot of appreciation also is for the integrase inhibitors and some for the protease inhibitors. And after years of research and trials, the ideal regimen for HIV now is just a combination of these drugs, keeping one drug from each family, but sometimes two drugs from antagonizing the reverse transcription family with some other accessory drugs. And combining these drugs and having some kind of regimen help the virus to stop the replication. And this is very important point. It will not eradicate the virus because the virus is still, and up to the moment, the most important problem for HIV is that it will stay integrated inside the host genome. We cannot remove it out the host of the host genome. But what we can do through this kind of treatments is to stop the replication cycle. So at least the proviral load will be decreased in the patient and the immune system will flourish and behave like normally. But in case at any point of time, the patient decide to stop the treatment or skip the treatment, within 2 weeks, literally 2 weeks, the proviral load will come again at its highest level, seeming like having an acute infection status. And the moral from this, that HIV infection treatment should be continued for the lifetime to suppress the viral replication, but not eradicate the virus because we cannot achieve this until the moment. So the next section, I will go for the HIV-associated infection and malignancies. So HIV-associated infection, because as we mentioned, the immune system is kind of damaged. So any kind of opportunistic infection or opportunistic or any kind of commensal that normally stays in our body without problem will flourish because the immune system is damaged. So the HIV infected patient without treatment can have a lot of opportunistic infections. I will name some of them, not all, but the most famous among all the infections are the pneumocystis pneumonia, which comes from a fungal infection, but cause severe illness, and it's the most common cause of pneumonia in people infected with HIV. The second one is candidiasis or oral thrush, and this is very, very common HIV-related infection. Sometimes people are diagnosed at this level if like they are poorly screened or something like that. So the candidiasis or having some oral white patches can help the diagnosis of HIV-associated infections. And the candidiasis causes a thick white coating on the mouth, tongue, esophagus, or vagina. The second most common infection is the tuberculosis, which is the leading cause of death among people infected with HIV and non-treated. Next also is cytomegalovirus, which already come from a herpes virus already being passed in our body fluids, but normally under our competent immune system, cytomegalovirus will not cause anything. So the healthy immune system can make this virus inactive, but in case the immune system is weakened during the HIV infection, the virus become active, causing damage to the eyes, digestive system, and lungs. Next, and very, very severe, is the cryptococcal meningitis. And finally is toxoplasmosis that can also affect the brain and can also affect the heart, causing even seizures, and can be, of course, fatal for the HIV-infected individual. And here we can see some diagnostic, images for some opportunistic infections that can accompany HIV. So here is the very common presentation of the candidiasis or the thrush, which is like some kind of white patches along the esophagus or mouth. Here is some kind of toxoplasmosis infiltrating the brain, and we can see this kind of white patches. And also, but not very common, is histoplasmosis that can happen as opportunistic infection during HIV. Next is our last target for today's lecture, which is HIV-associated cancers. So HIV-associated cancers, I should say, are still under investigation and need a lot of research to be confirmed. But in general, let's look at the reasons why cancer happen in HIV. Because HIV is not an oncogenic virus. It doesn't cause transformation of the infected cell into a cancer cell. But there are a lot of reasons that can enhance the cancer to happen in HIV-infected individuals. First, as we mentioned, is the immune dysregulation, meaning that the infected patient will have low CD4 count and will present some kind of chronic immune activation because the virus is usually expressing some kind of proteins every now and then. And this will cause T cell exhaustion, meaning that the T cells are tired to do their job. They cannot scavenger the infected cells, or they cannot behave normally, or they cannot even detect the cells that are transforming into cancer cells. Next is the happening of, as we mentioned, the co-infection with some oncogenic viruses like Epstein-Barr. Human papilloma viruses are on the top of oncogenic viruses that can co-infect the patient who already have HIV and help the development of cancer. Some others are like smoking, and some other reasons are aging, especially now after the introduction of antiretroviral drugs. The lifespan of HIV-infected individuals now is extended. They can have a nearly or apparently healthy life when they are treated. So they are living more, meaning that they can also have develop some kind of cancers just like a normal person. On the other hand, there are some, how to say, disparity. Like not everyone is taking the same amount of care or treatment during a lot of demographic reasons or availability of drugs or like the price of drugs, compliance to the drugs, health system factors like availability of the screening, and all these kind of factors can affect the timing of the diagnosis of HIV, the timing of introduction of drugs, and all this have consequences on the presence of the virus inside the body, and of course will help these risk factors to be augmented, and at the end cancer will develop. This is the general figure why cancers happen in HIV. But let's be more focused on the HIV most common associated cancers. So malignancies in HIV develop in about 25% to 40% of people with HIV/AIDS, which is a very high percentage. So we need to how to say, have a more focus on this kind of cancers. Of course, treatment, and try to avoid it as much as possible for HIV-infected individuals. So there is a long list of cancers happening in HIV-infected individuals, but today I picked the 3 most common types of cancers, which are non-Hodgkin lymphoma, Kaposi sarcoma, and invading cervical cancer. So let's link these 3 cancers with the role of immunosuppression in case of HIV, as we mentioned. Like there is a kind of immune dysregulation or immune cell disruption. So according to research, the finding confirmed that, for example, the non-Hodgkin lymphoma is so much associated to the immune suppression status of HIV. Next is Kaposi sarcoma, and cervical cancer is to less extent linked to the immune suppression status of HIV. But also we need to link one more factor, which is the etiological factors or viruses that cause this kind of cancers. So in case of non-Hodgkin lymphoma, there should be a co-infection with Epstein-Barr or human herpes virus 8. In case of Kaposi sarcoma is the KSHB. And finally, for the cervical cancer is the human papilloma virus. And this is a very important point because human papilloma virus is a very highly oncogenic virus. So it doesn't need the immune suppression status of HIV to lead to the cervical cancer. Just the infection by human papilloma virus is enough to cause the cervical cancer. In the next part of this slide, I want to take a more closer look at some mechanistics that have been reported according to research. Some mechanistics explaining how like the immune system and other factors behave inside the blood of infected individual and cause the HIV. Still, this branch is branch of research is under investigated, but some mechanistics are reported, and I would like to share today 2 mechanisms with you. So the first one is related to the non-Hodgkin lymphoma. And non-Hodgkin lymphoma, as we mentioned before, occurs in advanced stage of HIV with CD4 count getting below 100 cells. And the most common cause of pneumonia in people infected with HIV. But non-Hodgkin lymphoma also, as I said, is the most common cause of pneumonia. But this one is the lesions presented in case of Kaposi sarcoma. And in case of Kaposi sarcoma, we can see some purple patches on the skin, like skin lesions on the infected person. And the Kaposi sarcoma lesions have been widely investigated to get some mechanistics on happening or occurrence of this kind of lesions. So as we can see that in case of infection with human herpes virus 8 and the interaction between this virus and HIV infection. So let's look at some mechanistics happening there. Human herpes virus 8 release or cause some release of some inflammatory cytokines. These inflammatory cytokines along with some proteins and inflammatory cytokines caused by HIV, both of them help a BCL2 mechanism inhibition of P53. And as we all know that P53 is very important to prevent cancer formation. So inhibition of P53 will invite the occurrence of something like the Kaposi sarcoma lesions. Also, one more important thing is one main protein of HIV, which is TAT. TAT it helps the transcription of HIV, and because it helps the activation and the transcription of HIV, it has an anti-apoptotic role, and this kind of angiogenic and anti-apoptotic role still help the Kaposi sarcoma lesion to happen. So we here combine the causative agent of non-Hodgkin lymphoma to the lesion of Kaposi sarcoma, meaning that inside the HIV infected individual who is non-treated, there is some kind of coordination between the infections and several types of cancers. And the next and last slide I would like to show and spend some time on this is a very nice theory mentioning about the immune aging in case of HIV. Because during the HIV progression, what happened is the HIV caused chronic HIV-induced inflammation. Why? Because the virus is usually expressing some proteins and some free radicals. All this will help to destroy the immune system, as we have mentioned, and cause, again, the P53 inhibition. P53 is very important to prevent the cancer occurrence in the cell. So once P53 is inhibited, maybe not directly, like P53 inhibition in accordance with the release of cytokines and chemokines will help the CD4 surviving infected CD4 T cells to have some kind of proliferation, but with mutants. An accumulation of this kind of mutant clones will help the propagation of tumor formation inside the body of the infected person. And one and last most important mechanism is the T cells are attacked. So they are either dying by apoptosis because of the expression of the HIV proteins, and the other very subtle and dangerous mechanism is T cell anergy. T cell anergy meaning that the T cells are still intact, they are there, but they are so exhausted to perform the role of immune surveillance, meaning that T cells will be there, but they will not attack the cancer transforming infected cells. So they will give them a chance to flourish and cause the cancer, accumulate the risk. At the same time, they are not functioning to even attack the infected cells or the cancer cells. And this is a very beautiful mechanism that has been identified as immune aging in case of HIV-1 progression. So to sum up today's talk, AIDS is caused by untreated HIV infection, which is characterized by marked immunosuppression. Please don't forget that HIV is a preventable disease. Just we need to wear the protective clothing in case we are working with human samples or blood. And in case of married couples, they have to do screening and make sure that both of the partners are healthy, and also still screening of the mother during pregnancy. We should not share needles or do any kind of risky behaviors for illegal drugs to keep ourselves protected from HIV and other sexually transmitted diseases. And as I mentioned, there is no true cure for HIV, but it's treated with a combination of antiretroviral drugs, which can stop the virus from replicating in the body. And people with HIV or AIDS, of course, are more likely to get certain types of cancers. Mechanism of cancer in HIV-infected individuals is not fully understood up to the moment, but AIDS-defining cancers, including Kaposi sarcoma and non-Hodgkin lymphoma and cervical cancer, are the most three common types of cancers to happen. And lastly, more than 28% of HIV-related deaths are attributed to malignant tumors, and more than 40% of HIV-infected people are eventually diagnosed with AIDS-associated lymphoma, meaning that cancer in HIV should be heavily studied and hopefully to be prevented in HIV-infected individuals. I would stop here. Thank you very much. And let's start our discussion.
Yes, thank you very much for the interesting topics, interesting talk, Dr. Omnia. It's a very great to listen to your lecture.
Thank you very much.
You absolutely expert in your field.
Thank you very, very much.
Congratulations.
Thank you very, very much. Thank you very much.
Yeah.
Thank you, Dr. Milan.
So now if anyone have any question, so please raise your virtual hand or you can type your question in the chat box. Yeah, please. For the audience, okay, I have here Phoebe Melia Putri. Phoebe, could you open your camera and then turn on your microphone? Then please deliver your question. Thank you.
Okay. Good morning, Ms. Milan. Is my voice clear?
Yes, here.
Okay, thank you for the opportunities. So good morning for Dr. Omnia and also Ms. Milan, and also good morning for all my colleagues. Here I am, Phoebe Melia Putri, or you can call me Phoebe, from 6th semester of Diplomatry Medical Laboratory Technology. So in our semester, we have done some direct practical in several hospitals in Bali. And based on my experience, there's also some examination for diagnosing HIV, such as CD4 T cell count and also the one that called viral load test. So the things that's still confusing me is what is the difference between the CD4 T cell count and also viral load test for the diagnosing of HIV. That's all my question. Thank you.
I'm sorry, difference between CD4 cell count and...
Yes, cell
and
count
what?
and viral load. Viral load.
Viral load.
Yes.
Yeah. I got it. So I need to reshare my slides. So...
Oh, okay.
Yeah. Just a second. So in case of diagnosis, if we want to look at the viral load, we need to do like a PCR-based detection of HIV genetic material. Okay, so this represents the presence of HIV genetic material in the blood. Of course, HIV will release RNA, but we will do reverse transcription and detection of DNA by PCR methods. This is quite different from the presence of, like we can get back to this photo. Yeah. These red particles are the viruses, but we can consider them like how much genetic material is released into the blood. But on the other hand is the CD4 cell count. So CD4 is the immune cell that is targeted by the virus. So the CD4 after infection can die and like decrease in the number, as we can see from here, and is quite different from the number of virus particles in the blood being released. So these are two different kinds of tests. Proviral load gives us an absolute measurement of how to say reactivation behavior of HIV in blood. But for the CD4 T cells, it gives us information about the intactness of the immune system, how much the immune system is attacked and still compliant to eradicate the virus. So two different domains for the immune cell and for the virus particle itself. I hope this answers your question.
Yeah, Phoebe, is it clear for you, or do I need to summarize the explanation from Dr. Omnia?
No, yes, the explanation is already clear. Thank you.
Oh, okay.
for
Thank
Dr.
you.
Omnia.
Thank you,
Yeah.
Vivi.
Thank you, Phoebe. So yeah, Dr. Omnia, your topic today about the test for HIV diagnosis is a very important for our student, because we are in medical laboratory technology. So we have to know how to diagnose those kind of infection, HIV infection, by what kind of test or method. So yeah, thank you very much for
Thank
that
you.
explanation.
Thank you for the comment. Thank you very
Yeah.
much.
Is there any question, another point to raise, maybe? Someone? Oh, I guess we have the question from the meeting chat.
Yeah.
Oh, okay. We have two questions, Dr. Omnia. Let me read for you. So, good morning, doctor. My name is Anak Agung Kanya Wiatnyani from class 2A. Let me ask a question. As I know, Muslim men usually undergo circumcision, or in Indonesia we call it sunat. Okay, circumcision. Is that familiar for you,
Yeah, yeah.
Dr. Omnia? Okay.
Yeah, yeah.
Then I read that circumcision can reduce the risk of contracting HIV by up to 60%. My question is that true, or how to explain it in a medical way? Thank you, doctor.
Yeah. Thank you very much for your interesting question.
Yes.
Circumcision, of course, reduce the risk of contracting HIV. I'm
Mhm.
not sure about this high percentage, but it reduced the risk for contracting HIV. And medical explanation, simple explanation for this, that
Yeah.
getting rid of any, how to say, body part that could accumulate secretions, risky secretions, or invite for any kind of infection. So that's like a general explanation for why circumcision can reduce the risk for HIV. Yeah. And any other infection. Yeah, yeah.
Okay.
Yeah,
Okay.
thank you.
That's great. Yeah. That's great. So yeah, I even never imagined that. Oh yeah, circumcision, is that any related to the hygiene, that personal hygiene, right?
Yeah, yeah, and
Kind
it's
of.
documented in the field that like
Mm.
yeah, it reduces. I can
Mhm.
check the percentage, but I'm not
Uh-huh.
sure. 60% sounds a lot for me, but
Yeah,
let's check.
it's
Yeah.
a lot. 60%. In where? In around the world, or some Muslim country, maybe?
Yeah. We need to
Yeah,
have
we need
like
to
how
check
to
that.
say decrease.
Sure. Okay, let's move to another question. Is there anyone want to give Dr. Omni a direct question, or should I continue reading the meeting chat? So sorry. So sometimes my students are a bit unconfident with their English. So
It's
that's
no
why.
problem. Yeah, please feel free to express yourself.
See? So Dr.
No problem.
Omnia invite you to ask, guys. So please ask.
Please. Yeah.
Ask directly, because your question is very good actually in this meeting chat. Okay, I will continue. Good morning, Dr. Omnia. So her name is Ninyomansri Suarningsih. Same class, undergrad student. Okay, let me ask you, why someone infected with HIV is susceptible to various type of disease?
So good morning, Neumann.
Nyoman.
Newman.
Yes.
Thank you for your question. So as we mentioned, HIV attack the immune system, and the immune system is very important to prevent infections and cancer progression for any healthy individual. So once we have a virus that target the immune system and make it, like to say, incapable of doing its job, then a lot of infections, opportunistic infections, commensal bacteria even flourish because there is no guardian to protect us from the infections or associated cancers. So that's
Yeah.
why HIV has a very high risk of inviting other infections.
Exactly. Yes. Yeah. Can you Ninyo Mansiswarningsi, is that the explanation from Dr. Ramnia is clear for you? Do you have any other question maybe regarding this?
Excuse me,
Yes.
ma'am.
Yes. Yes.
From me, it's all is clear, and thank you, ma'am
clear?
Omnia.
Yeah, I hope
Thank you. Thank you
Yeah,
very
yeah.
much.
I hope you can understand that. Yeah, you're still far away from the immunoserology lecture in 4th semester. So in our university, Dr. Omnia, we have this kind of topic in our lecture called immunoserology topic in 4th semester. So
Wow.
they're still in the 2nd semester, so not yet in there.
Not yet.
Yeah.
Okay.
Yeah.
Today is a brief introduction. Like
Yes, brief introduction.
Yeah.
Okay, so we continue the 3rd question to Dr. Omnia. Oh, she has from whom this one? No name. Okay. 2 question. What kind of laboratory tests? Oh, okay. Before we read this question, someone raise hand, Dr. Omnia. Let's ask her. Let's give her the opportunity to ask directly to you.
Yes, please.
Yes. Niwayan Gita Aprilia. Please open your
can you
camera.
hear my voice? Is it clear?
Yes. Yeah. Is it clear?
Yes, we can.
Can you
Okay,
open the camera first? Thank you.
I'm sorry, I cannot open it because there is a lot of people here.
Okay. Okay. Then
Okay,
yes.
right. Good morning,
your
honorable
question.
guests, Dr. Omnia, Ms.
Good
Wilan, and
morning.
everyone on this meeting. My name is Gita from Applied Bachelor of Medical Laboratory Technologies, and I'm currently in my 2nd semester. Well, first of all, I would like to apologize for my bad English. I'm literally shaking right now. I'm so nervous to ask you a direct question because my English is not that
It's
good.
totally okay and clear.
I'm sorry.
Yeah.
Okay. Okay, all right. Actually, I would like to ask you 2 questions. Is that okay?
Yeah, of course. Go on.
Okay. My first question is, I've read about PrIP, pre-exposure prophylaxis, which can be taken on demand, such as before sexual activities, and it was used to prevent the spread of HIV. So, does this imply that HIV cannot be cured? Does this PrP lose effectiveness after a few hours, providing only temporary preventions, and it's not actually cure HIV? And do you probably I'm so interested to learn about this HIV HIV cure, and also how to defeat the virus. So probably you could recommend me any research on HIV cure that I should read. And also my second question is, in this semester I learned about drug resistance. Does drug resistance also occur with HIV? And how this drug resistance develop, and what strategies are used to manage and prevent drug resistance HIV strains? And also, is this drug resistance related to the destruction of CD4 cells caused by HIV infections, as you shown in the diagram you presented earlier? Okay. Those are my questions. Once again, I apologize for my English, and I'm sorry I cannot open my camera.
Your English is great, but yeah. I want you to keep connected because maybe lots of questions, so I need to cover all of the points. So stay with us until we finish. So your first question was about the pre-exposure prophylaxis and if HIV could be eradicated or not. So HIV basically cannot be eradicated.
The problem with HIV is I can take a moment to show you some other slides. Uh, eh, so, as I mentioned, HIV integrates itself into the a host a genetic material. So no kind of drug up to the moment can eradicate the HIV, because eradication means that we can reach. Sorry, I'm just looking for the accessory slides. Give me a moment. Yeah, I can share this one. Yeah, so from this slide, we can see that HIV integrate inside, oh, sorry, I need to use the pointer. HIV integrates into the human host genome. So in case of ART, we are just inhibiting, if we look at this axis, this is HIV RNA in plasma, meaning how many virus particles are expressing its genetic material into blood. So at first, before treatment, HIV RNA is very high into blood. But in case we started the treatment, virus replication will be decreased, but not, how to say, not removed. Because to remove the expression or to get rid of the total HIV RNA in plasma, we need to excise HIV from the human DNA, which is not possible until the moment. A lot of research, because the curative research is my domain. So the problem is we cannot until the moment remove HIV. So what are people doing? Because people are trying several eradication strategies. Eradication strategies meaning that they are trying to get rid of this integrated provirus to stop the whole process of HIV infection. So examples for this are this one. So we have two very famous, you can see the slides.
Yes, yes.
Okay, so there are two famous strategies. One of them is called block and lock. And if you, because you asked inviting for research to read about, so I recommend reading about block and lock strategy. And block and lock strategy is a strategy to help the provirus to remain inside, because we cannot eradicate, okay? So we can keep the genetic material inside the cell, but through some epigenetic mechanism, we can help the virus to stop expression at all, meaning that we are locking the virus inside the cell. So this is one very famous strategy for HIV eradication. The other one, but I cannot find the representative slide now, called latency reversal. So latency reversal is the other way around. Latency reversal is focusing on helping the provirus to express. I'm sorry, I cannot find the slide, so I don't want to share confusing slides. But the other strategy is called how to say, latency reactivation using LRAs, meaning that we are trying to help the provirus to express as much, and then we kill the cell, the infected cell. And how do we kill this cell? Because we know that there are a lot of expressing virus coming from this cell. So the two eradication main eradication strategies are the block and lock and latency reactivation strategies. You can read about. Some other very specific research are trying to excise the provirus from the integration by CRISPR-Cas9. You can also read about it. But the main problem is that using CRISPR-Cas9 in humans or in human cell is not, of course, so safe. So a lot of trials, they are just trying to think how to remove this kind of integration, then we can reach an eradication level. But the ART, this PrEP or ART, they just function to stop the expression, but the virus is still there inside the cell. Okay. Other questions you can say again if I missed any point.
Yeah, Gita, could you understand the explanation for the first and the second question? How many questions do you have? I'm sorry.
Only 2 questions, Miss, and yes, I can understand it easily. This only just a basic questions because I'm still new to this kind of explanations. I mean, the integrations and the proteins of HIV. It really interests me so much. So yeah, I could understand it.
Okay,
It's
good. Do
Happy
you
to
have
hear.
any other question that left? Not yet answered by Dr. Omnia?
I think about the drug resistance. Does
okay.
Drug resistance, yeah.
Yeah.
This one, give me a second.
Okay.
So first, I found a more interesting slide about the eradication. So this one summarizes all the HIV eradication strategies, stem cell transplant, but this is like a kind of specific trials. You can see, read about it. The CRISPR-Cas, as I mentioned, to excise the HIV, and shock and kill strategy, meaning latency reactivation, and finally block and lock.
Block and lock.
Yeah. The other slide about the resistance. Resistance come from the mutation, and I want to show one slide demonstrating the accumulation of mutations. The problem with the resistance is accumulation of mutations in the genetic material of HIV. Then suddenly the drug cannot help stopping the replication cycle because the virus is not responding.
Okay.
So this comes from a very famous phenomenon in HIV called clonal expansion. Yeah, this one. So clonal expansion, meaning that HIV-infected CD4 T cells will divide over time and accumulate. Okay, because the virus inside this kind of cells is quiescent. It's not expressing. So the immune system cannot have a doubt about this cell. So these cells are nearly like normal cells, and they are expanding. So there are two types of mutations. Some mutations happen in the genetic material of the HIV itself, and some, as we mentioned in the cancer progress, happens in the infected CD4 cell by itself. So drug resistance, of course, is related to the virus structure, and the mutations of the cells are related to the cancer progression. Also, you can read this paper, although it's a very advanced one, but I invite you to read some about it from cell host microbiology. But yeah, and we can at any time discuss if you want to.
Yes, that's very interesting. Invited. let me back to Gita. Gita, are you there?
Yes, Miss.
Yes, still there.
Okay. So,
And by the way,
how-
your English is very excellent, so please be confident about
Thank you so much. I'm still learning.
Hmm. Yeah. So, will you read those journal that Dr. Omnia recommend you?
Yes,
Will you
probably
read that?
Yes, probably I will read it, but not now.
Okay.
I mean, I like to read journals at night when I cannot sleep. So I started to read. So I started to read journals that probably could get me into sleep because I'm bored. Just
Yeah.
read.
Okay.
yeah, complicated stuff. Then
Yes.
you prefer
Puts me
to
on to
sleep.
sleep.
Yeah, I understand.
Okay. Well, I
Thank you,
think
Gita. Mhm.
yes.
Yeah.
Thank you so much. Thank you so much, Dr. Omnia, for the
Thank you.
explanations. It's really helped me understanding more about HIV, and I hope in the future I could also doing research like you and also become awesome just like you, Dr. Omnia, and also
Thank
Miss
you
Yulan.
very much. Thank you.
But
I hope
also
the best.
awesome.
I
Yeah.
hope the best for you, and feel
Okay,
free to
thank
contact
you.
me whenever you have any questions.
Yeah, thank you so
Okay.
much. Thank
All
you.
the best. All the best.
Thank you, thank you. So yeah, we almost run out the time, but I will give one last chance to the audience who will ask the question, a direct question, I mean. For the question in the meeting chat, I will forward to you, Dr. Omnia. So yeah, you can type the answer in the word maybe. So I will deliver to the student.
Okay.
Because we have a lot.
And we have a lot, yeah.
Yes. Is there any question? One more question? No? I guess for the undergrad student, this topic is very related with your one of your lecture, molecular biology. So I hope that one of you will ask something about molecular biology related to HIV test or cancer test. Is there anyone? No? Okay, then. I think from Gita's question is the last question, Dr. Omnia. We almost time to the closing. So yeah, ladies and gentlemen, we finally come to the end of this session. Before I close this session, I would like to take the conclusion from that what the speaker presented. So I have I make a note in here. The first, it is caused by untreated HIV infection, which is characterized by marked immunosuppression. This is interesting, immunosuppression, that students need to learn more about this kind of topic. So there is no cure for HIV infection so far. I guess you already know as well as cancer, HIV infection also no cure yet, yeah, to discover. So still unknown territory for the researcher to find out more. So people living with HIV and AIDS are much more likely to get certain type of cancer, which called AIDS-associated cancer. This will be my field of interest, actually, how the viral infection can lead to the development of the cancer. Yeah, Dr. Omnia, we will.
So interesting. So
Yes,
interesting domain.
we will have collaboration then next.
Yeah, please.
Maybe
Yeah,
kind
of
of joint research or something.
Yeah, for my
Yeah.
honor. Yeah.
Yes. And then even though the mechanism of the cancer in HIV infection individual isn't fully understood yet, so that's
Yeah.
why I interesting in this field. So next time maybe we can talk more about this, how the viral infection affects HIV infection, especially to develop a cancer. Yeah, but that's all the conclusion that I can make for today's lecture. Thank you very much, Dr. Omnia.
Thank you, Dr. Willan.
Yes, is it Mrs. Diana already in this meeting room? The committee, could you help me please to check or to give
I'm just arrived, Miss Wilan.
oh, okay. Okay. Okay, ma'am. So yeah, are you ready for the
In
next
time, really in
agenda?
time. I just arrived.
Okay, okay. I will give you time to breathe first. So as a token of our appreciation to our guest speaker for her time and her valuable contribution, may I request to the head of Medical Laboratory Technology Department, Mrs. Igusti Ayu Sri Diana Putri, to kindly present a certificate to our guest lecture.
Okay, thank you, Miss Wilan. Dr. Omnia, I'm
Thank
really
you very much.
grateful to have you here. Thank you very much.
Thank
It's
you. My
really,
pleasure.
very good information and sharing knowledge you give to our students. It's
Thank you
very
very much.
useful. Thank you very much.
Thank
Maybe
you very
this
much.
time we just meet online. Next
Yeah,
time we hope
in
we hope
person.
you can visit Indonesia next time.
Of course, it would be my pleasure and honor, of course, to do. Let's
Okay.
hope soon.
I will
Okay.
invite you then, Omnia,
Yeah, please.
personally.
Yeah, I would be happy to. Yeah, I would be happy to visit.
Thank you
Yeah,
very much.
thank
Now
you very
please
much for the
accept.
opportunity.
Please accept the online certificate as a thanks for you.
Thank you
And
very
next,
much.
okay, thank you. We're gonna send the certificate through your email. Yeah, please.
Thank you very much.
From now on, please accept the online certificate.
Thank you very, very
much.
much. Thank you very much for the opportunity. I was very, very happy to, like, for the first time join you. And yeah, the questions from the students are very, very interesting, and I would be happy to meet them in person and discuss more. So yeah, thank you for the great opportunity, and thank you for organization and giving me enough time to explain. Thank you very much.
Welcome.
Thank you.
Yeah,
Pleasure
that's
is mine.
make our students have confidence to speak in English. That's the other side of the benefit of today's event.
Their English is very well. Yeah, I understand. Yeah, quite well. Yeah.
Thank
I
you very
hope
much.
some of them, I should say, like be interested in HIV research later in their later stage of life, and I will be happy to help at any time. So yeah, any motivated student, please let me know, and I can help with some resources, of course.
Thank you
Well,
very
thank you.
much, Dr.
Yeah, thank you, Dr.
Yeah.
Omnia.
Thank you very much.
Yeah. So I guess we are already in the end of the certificate presentation ceremony. So let me close this session. Ladies and gentlemen, thank you for your participation in this guest lecture series. I hope you enjoy this program, and I look forward for your participation in the next guest lecture. Finally, please give applause to the speaker and for you all, the participants. Thank you very much, and have a good day, everyone.
You
Thank you
too.
very
Yeah,
much,
yeah, yeah.
Omnia.
Thank you very much. Thank
Yes.
you. Thank you. Thank you
Talk to
very
you
much.
later then. Thank you.
Thank you. Thank you very much.
Up next, I will hand over this virtual floor to the MC. MC, are you there?
Yes, Miss Wilan, I'm here.
Yeah, okay. Yeah. It's yours now.
Next we're going to give the certificate virtual for our moderator, Miss Luade Wilan Krishna. Here is your certificate, Miss Wilan. Thank you very much.
Thank you very much, Miss Wilan. It's a beautiful moderator. Thank you to guide this guest lecture. It's really, really interesting and very useful to our students. Thank you very much.
My pleasure is mine. Thank you.
Well, we thank the speakers and moderator who have taken the time to attend the guest lecture series 5 today. Ladies and gentlemen, the next event is a documentation session. We ask all participants to activate the Zoom camera first. I will guide the documentation session. starting with slide 1. 1, 2, 3. Slide 2. 1, 2, 3. Slide 3. 1, 2, 3. And so on. The next event is filling the final attendance. We ask all guest lecture series 5 participants to fill in the final attendance link. The link can be accessed in the Zoom chat room or by scanning the barcode listed on the Zoom screen. To fill in the attendance is given 5 minutes starting from now. Thus, the Series 5 guest lecture event with the topic HIV infection and cancer risk. Thank you all attendants who have been pleased to attend this event. We apologize if during the event there were mistakes either intentionally or unintentionally. Finally, we close with Paramasanti. Om Santi 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 Om. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, greetings to all of us, and see you in the next guest lecture series. Have a nice day.